Welcome to the Explainer. I actually want you to do something for me right now. Just take a second, pause whatever you're doing, and look down at your hands. Examine your fingernails really closely for a second. Do you see anything? Specifically, I mean those tiny, vertical lines running from the base of your nail right up to the tip. If you do spot them, well, you're definitely not alone, and you're absolutely going to want to pay very close attention to what we uncover today.
A lot of us notice those vertical ridges and just brush them off, right? We think, oh, it's just an annoying aesthetic flaw. Or maybe it's just getting older, everyday wear and tear, or maybe we just need a better manicure. But what if I told you that those little lines are actually a highly sophisticated internal dashboard? They are literally early warning signs flashing right at your fingertips, giving you crucial, immediate information about your overall health. Exactly, they're internal alarms. So think of this as a sort of medical mystery that we're going to solve together today. We're going to peel back 3 deeply interconnected layers to uncover what's really happening inside your body when these lines show up. It's this fascinating biological chain reaction. And honestly, by the end of this explainer, you're going to look at your hands in a completely different way.
Okay, let's dive right into this. Our very first layer, our first suspect, is simply the missing nutrients.
At a really foundational level, your body is just a highly complex machine, right? And it needs very specific fuel to run. When you have a straightforward deficit of essential micronutrients, which usually comes from an unbalanced diet, your biological functions start to sputter. And your nails? Well, they happen to be one of the very first places to show physical evidence of that internal shortage. Let's look at the main culprits here. If your diet is missing zinc, iron, or biotin, you are going to see systemic, widespread issues. Missing zinc doesn't just mess with your nails. It causes poor wound healing, you might lose your sense of smell, and it weakens your immune system. What about a lack of iron? Well, that brings on heavy fatigue, weakness, pale mucous membranes, and really poor concentration. And a biotin deficiency? That leads to itchy skin, mood changes, hair loss, and, yep, those vertical ridges. So it's an entire systemic body reaction to missing just a few key elements.
So that brings us to layer 2, hypochlorhydria, or what we can call the gastric blockade.
Now, you might be looking at your diet and thinking, wait a second, I eat plenty of nutrient-dense foods. But what happens if you are getting the right nutrients, but a broken mechanical process right inside your stomach is literally preventing you from absorbing them? That brings us to a really eye-opening medical condition called hypochlorhydria. Basically, this is a gastrointestinal disorder where your stomach just fails to produce enough hydrochloric acid. Think of stomach acid as the vital key that unlocks the nutrients from the food you eat. If you don't have enough acid, that door just stays locked. So your stomach is essentially starving your nails and the rest of your vital systems of the very nutrients we just talked about, simply because it can't absorb them.
And just like those nutrient deficiencies, this gastric blockade cascades into some pretty severe full-body distress. Just look at these wide-ranging systemic symptoms: profound fatigue, weakness, skin problems, sudden facial redness, and sharp mood swings. You could also be dealing with bloating, diarrhea, constipation, persistent acidity, hair loss, and even suddenly developing new food intolerances. The crazy thing is, people often treat these things individually, going to a dermatologist for the skin or maybe a therapist for the mood, but it's actually a massive systemic alarm going off, and those ridged nails are just one tiny part of the whole siren. So what actually causes this critical lack of acid in the first place? Well, here is the incredible irony. One of the primary causes is the heavy overuse of so-called gastric protectors, like omeprazole and lansoprazole. We take these meds to protect our stomachs, right? But they can actually shut down acid production so severely that they cause this nutrient-blocking condition themselves. Other causes can be excessive antacid consumption, inflammation of the gastric mucosa, bacterial infections, or honestly, even just eating a diet that's too poor in protein to properly stimulate that acid production. Now, what's really interesting here is a shocking little piece of trivia about a very popular antacid brand, known in some regions as Almax. Did you know that the name Almax literally stands for Aluminio al Maximo, or maximum aluminum? No way, right? But it's true. When people chronically consume certain antacids, they need to be incredibly careful and really read those labels because they might be unwittingly consuming heavy metals. And that just further complicates their internal health and totally wrecks their nutrient absorption.
Which leads us directly into our final, kind of invisible mastermind here. Layer 3, stress, the ultimate resource thief. Okay, imagine this super frustrating scenario. Your diet is absolutely perfect. Your stomach acid is perfectly balanced, and your body is successfully absorbing all those great nutrients.
But those vertical ridges are still there. Why? Well, because your brain is stepping in and flat out refusing to deliver those nutrients to your nails. And this brilliantly illustrates why. To your incredible, survival-focused body, your fingernails are completely non-essential tissue. They are, to use a perfect metaphor, the last wagon on the train. If there's any sort of problem, crisis, or shortage on that train, the last wagon is always the very first one to get its power cut. When your body perceives a major emergency, which, by the way, is exactly how it interprets chronic stress, it immediately goes into fight or flight survival mode. It redistributes blood flow and all those precious, hard-earned nutrients. It prioritizes the VIPs, the priority organs like your brain, your heart, and your muscles. To keep those running perfectly during a crisis, it actively starves the peripheral tissues, your skin, your hair, and yes, your nails.
So the crucial point here is that stress creates a massive internal distribution problem. You experience chronic stress, your sympathetic nervous system completely hyperactivates, your body fails to adapt to that daily stress, and boom, resources are entirely redistributed away from your nails. Your body has the nutrients, but it intentionally refuses to send them where they belong. And that results in those visible, physical, vertical ridges. I mean, have you ever connected a ridged fingernail to a terribly stressful month at work? Because it is all completely connected.
So wrapping all this up, it really does come down to your health being right in your hands. We've unraveled quite the medical mystery today, haven't we? By looking at something as simple as a fingernail, we've seen how deeply and beautifully interconnected your diet, your digestive mechanics, and your mental stress levels truly are. You are looking at a permanent, real-time visual dashboard of your internal health, literally right at the tips of your fingers. Which brings us to the most important question of all. Take one more look down at your hands right now. What are your nails trying to tell you today? Are they asking for better fuel? Are they warning you about a gastric blockade preventing absorption? Or are they just begging you to finally slow down and manage your stress? The clues are right there in front of you. You just have to be willing to listen.